my wife and I have been binging on caseamines, calamines, and that whole good energy component where the food that we eat is absolutely horrendous. It's not even legal in Europe. So you look at, again, when you talk about the complete pivot that we've had from the liberal consistency of, oh, we need to have really good food, the pharma companies are really bad, to now they're the complete opposite.
Yeah.
Don't talk about Cheerios and Fruit Loops being different in different countries, and the pharma companies are the end all be all. It's been pretty interesting to see, but I agree. If RFK can fundamentally change the health of our society, now our children in 2040 will be able to have those grandkids and move forward.
So that's the interesting thing about that, right? Because I think you're the first year of millennial. Is that right?
So 82, it technically
you're like
started
an
right around
exennial.
80.
You're right on the cusp.
I'm
right?
right on there.
So big generations make big generations. Small generations make small generations, right? The boomers begot the millennials, the Xers everyone forgets about. Sorry guys, but it's just true. And now the millennials are finally, a decade later starting to have kids. And we will have a big generation, probably not as big as the millennial cohort is top line, but we, the millennials, are going to have to work productively until our kids come into the marketplace and kick us out of the jobs that we have. It's just going to be that simple. But we have to have a healthy working public to, take advantage of the new roads that we're going to have and the lower debt to GDP. I mean, as much as I hate to say it, it's kind of dark, but like at some point we're not going to have $100 to $150 trillion of unfunded liabilities hanging around our neck because the boomers are going to attrit and we're not going to be paying for the social services that we owe them. Right. That's going to fundamentally change the balance sheet and the complexion and the future that's available to the United States. And you need healthy people to take advantage of that. Right. And then, I mean, God, like we could even get into, a little bit around the post-COVID fallout of, for a variety of reasons, all-cause mortality being through the roof, right? Cancer, people that have experienced cancer and were in remission and are now not, like that, the incidence of that happening is skyrocketing. Like we're in a health crisis in the country right now, not mental health, not drug addiction. Like, yes, all those things are there too, but I mean like physical, I can't get out of bed to go to work anymore, health problems.
Yeah.
And you roll that out at scale across an economy. Like we can't afford it anymore. So I look at RFK doing what he's going to do with, food and prescription drugs, hopefully as like table stakes. Like it's not even an option. Like we have to clean ourselves up.
Yeah.
Right. For us, for guys like you and me to be healthy into 50s and 60s and beyond, and for our kids, because that generation is critical to the future of the country.
That's right. That's right.